Hello, humans. Michael Herrick here with HIPAA for Humans, realistic cybersecurity advice for healthcare. I'm recording this in the summer of 2021, and the end is in sight. Here in my state, vaccinations are up, cases are down, hospitalizations are down. People are getting out, seeing their friends. They're enjoying a more normal summer, and that's all thanks to you who work in healthcare, you who have gotten us through these unprecedented times with your commitment to healthcare. So big thank you to all of you who have gotten us where we are today. And I hope that you're also starting to enjoy a new normal. I hope that you're starting to enjoy some relaxed restrictions and being able to get out and do things that you enjoy with your family and friends, maybe even without a mask, fully vaccinated out there in the world. So thank you for that. And as we're all getting ready for this new normal, I know we're not out of the woods yet, but now's the time to start thinking about how this is going to affect your HIPAA risk management strategy. The pandemic has affected every part of our lives, and HIPAA is no exception. So we have a webinar coming up this month that's designed to help you get ready for that new normal, that new post-COVID-19 normal for your HIPAA risk management program. We're going to talk about a couple of different topics in this webinar. First of all, we're going to talk about HIPAA enforcement. If you recall, at the very beginning of the pandemic, Health and Human Services announced a period of enforcement discretion during which they were not going to hold covered entities to the full letter of the law as regards the HIPAA security standards, the HIPAA privacy standards, with regard to certain new technologies adopted to respond to the pandemic. So if you've adopted any new technologies since the beginning of the pandemic, if you've adopted new technologies like video conferencing or even just patient telemedicine phone calls, if you've adopted any new technologies around scheduling, around coordinating vaccinations, things like that, you really should come to this webinar or send somebody to this webinar and make sure that the systems that you've put in place during that period of the national emergency, make sure that those systems are going to meet the requirements when this period of enforcement discretion ends in the very near future. We don't know when it's going to end, so you want to be ready with a plan. And if your current systems are not ready for full compliance with the HIPAA privacy rule and the HIPAA security rule, we're going to share with you a very simple roadmap to get you there, what you should start doing right away to prepare for that new normal post-COVID-19. We're also going to talk about our new way of working. I'm sure many of you are getting back to the office with more frequency now. I hope you're enjoying that. But I hope you're also enjoying a little bit more work from home than you ever had before the pandemic. Work from home is here to stay. It's going to be part of our lives, even when this pandemic is a distant memory. And I think that's a good thing. However, a lot of our old cybersecurity models are not particularly well adapted to this new, more flexible way of working. So at this webinar, we're going to talk about that a little bit too. We're going to talk about new security models, really a new kind of cybersecurity philosophy, as well as some specific cybersecurity controls and HIPAA compliance requirements that you can implement to make sure that the people who are working from home are every bit as secure and compliant as the people who are working at the office. So look for the link to that webinar, HIPAA after COVID, entering a new normal. Look for that link, share it with the people at your organization, people in the IT department, people in the compliance department who need this information to prepare your organization for that new normal post-COVID-19. I hope to see you at the webinar, and I hope you'll join me here each week for more HIPAA for Humans. I'm Michael Herrick. Thanks for watching.